Hello, I'm Dr. Tracy Paschke with Heart Health Prevention and Wellness. I wanted to start a series on some of the risk factors for heart disease, and I wanted to start today talking about hypertension or high blood pressure. So, high blood pressure is very prevalent. It poses significant risk to heart health, and it often is known to people. You may have heard it called the silent killer, and that's why, because often it doesn't have any symptoms associated with it. So, what is high blood pressure? Blood pressure is the force exerted the blood on the vessel walls. So it's measured in millimeters of mercury, and it's given as two numbers. The systolic reading, which is the top number, it's the pressure during the heartbeat, and the diastolic reading, which is the bottom number, which is pressure between heartbeats or at rest. So high blood pressure is defined as consistent readings greater than 130/90. So normal blood pressure is 120/80 or below, and anything above that is too high. So the 120 to 130 range we say is pre-hypertension, but anything over 130/90 is defined as high blood pressure. The causes of high blood pressure can vary. There's what we call essential hypertension, which is high blood pressure that develops gradually over the years without any obvious cause. And then there is what we call secondary hypertension, which is caused by a specific underlying condition such as kidney problems or hormone problems or even certain medications. Risk factors for essential hypertension include age. People tend to develop high blood pressure as they age. Family history, being overweight or obese, lack of physical activity, tobacco use, excessive salt intake, inadequate potassium intake in the diet, alcohol consumption, stress, and other certain chronic conditions. So unchecked high blood pressure can lead to serious health issues. It's a very strong risk factor for heart disease, stroke, heart attack, heart failure, kidney problems, problems with vision, and memory problems. So preventing and managing high blood pressure involves lifestyle changes and sometimes medication. So the lifestyle modifications that we emphasize are a whole food plant-based diet, which emphasizes less meat, less animals or animal products, more fruits, vegetables, whole grains, lean proteins, beans, less processed foods, which are often high in salt. Cheese is often high in salt. People may not be aware of that. And then there's the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. And that's a diet that was specifically designed to help lower blood pressure, so you can look into that one as well. As far as exercise, we recommend 150 minutes of moderate intensity physical exercise a week, and that's been shown to reduce blood pressure. Weight management is important. We know that the blood pressure curve follows the weight curve, and so as people lose weight, their blood pressure goes down. Alcohol and smoking can both increase blood pressure, so we tell people to refrain from either one of those things. Some people are very susceptible to salt or sodium in their diet, so even a small reduction in the sodium in your diet can sometimes improve high blood pressure. Managing stress is important. Stress increases our certain hormones in the body that can elevate our blood pressure. So we recommend things like meditation, deep breathing, and relaxation exercises. And then if you try those things and your blood pressure is not at goal, sometimes we put people on medications. Of course, you'll need to work closely with your physician to find the best blood pressure medication for you. So in conclusion, high blood pressure is a significant health concern that can lead to severe heart conditions, problems with the kidneys, problems with vision, increase at risk of stroke. So it's very important that we know our blood pressure numbers. So I tell my patients that just like we know our weight, we also need to know our blood pressure numbers. So these days you can buy a blood pressure cuff on Amazon or at the pharmacy or your local Walmart or Target. Get an upper arm blood pressure cuff, not one that goes on your wrist. Those aren't as accurate. So an upper arm blood pressure cuff, and you sit relaxed with your arm level with your body. Make sure you don't have to urinate, because if you have a full bladder, that can increase your blood pressure. So you're relaxed, your feet are on the floor, you're not talking, you're just sitting there relaxed for a few minutes, and then you blow up the blood pressure cuff. Just hit the button and it'll give you a reading. You let it down, you wait a minute or so, get another reading, and you might even do a third, and then you average those numbers. I tell people to check their blood pressure at different times of the day in different settings, because you want to know what your blood pressure is averaging over time, right? Blood pressure constantly fluctuates, but what are your average readings? So that helps to get a good idea of what your readings are. And then if you see that your blood pressure is running high consistently, that's when you need to take your numbers to your physician and have your doctor review those with you. All right, so join us next time as we explore other risk factors for heart disease.